This is Hindsight Radio.
I represent it.
The information station changing the nation.
Peace, everybody. This is Akeem from Hindsight Radio, the information station changing the nation. I want to make a really quick video about the statistics of COVID-19 right from the CDC website. You can see it here, cdc.gov/NCHS/VSR/COVID-19/. That's it. Now, this link is very hard to find. If you just go to cdc.gov and you try to find this particular page, you're going to catch hell. So I gave you the direct link to it, and I'll leave it in the description below once this video is posted. So this is the daily updates of totals by week and state. Provisional death counts by coronavirus disease COVID-19. So, and it has a note here. Note, provisional death counts are based on death certificates data received and coded by the National Center for Health Statistics as of May 18, 2020. Death counts are delayed and may differ from other published sources. See technical notes. Counts will be updated periodically. Additional information will be added to this site as available. Also says the provisional counts for coronavirus disease COVID-19 deaths are based on the current flow of mortality data in the National Vital Statistics System. National provisional counts include deaths occurring within the 50 states and the District of Columbia that have been received and coded as of the date specified. It is important to note that it can take several weeks for death records to be submitted to National Center for Health Statistics, NCHS. Processed, coded, and tabulated. Therefore, the data shown on this page may be incomplete and will likely not include all deaths that occurred during a given time period, especially for the more recent time periods. Death counts for earlier weeks are continually revised and may increase or decrease as new and updated death certificate data are received from the states by NCHS. COVID-19 death count shown here may differ from other published sources, as data currently are lagged by an average of 1 to 2 weeks. So they're saying they got a lag. The provisional data presented on this page include the weekly provisional count of deaths in the United States due to COVID-19, deaths from all causes, and percent of expected deaths, i.e. number of deaths received over number of deaths expected based on data from previous years. Pneumonia deaths, excluding pneumonia deaths involving influenza. Pneumonia deaths involving COVID-19, influenza deaths, and deaths involving pneumonia, influenza, or COVID-19, A, by week ending date, B, by specific jurisdiction. I need to read that again because that confused the hell out of me right there. I don't know about you, so let's read that one more time. The provisional data presented on this page include the weekly provisional counts of deaths in the United States due to COVID-19, deaths from all causes, and percent of expected deaths, i.e., number of deaths received over number of deaths expected based on data from previous years. Pneumonia deaths, excluding pneumonia deaths involving influenza. Okay, so excludes pneumonia deaths involving influenza. Pneumonia deaths involving COVID-19, influenza deaths, and deaths involving pneumonia, influenza, or COVID-19, A, by week ending date, and B, by specific jurisdiction. So it's still, you see, this is why people don't trust certain sources, because that's confusing if you read that, because it did say excluding pneumonia deaths involving influenza. So that's the only thing it excludes is that. Okay. Table 1 has counts of death involving COVID-19 and select causes of death by the week ending date in which the death occurred for COVID-19 deaths by week ending date at the state level. Table 1, deaths involving coronavirus diseases 2019, COVID-19, pneumonia and influenza reported to NCHS by week ending United States, week ending 2/1/2020 to 5/16/2020. So they're not even giving, well, they're starting the dates off from February 1st, 2020 until the 16th, which was a few days ago. This is what they say. These are their updated numbers. And it shows you week by week, starting 2/1, and how it escalated in April. And now it's really starting to taper off. This is good news, isn't it? Because it says COVID-19 deaths right here. So from 4/25, starting weekend to May 2nd, we only had 7,069. That's a big jump, drop, And then we had May 9th, about half of what it was the week before. And shoot, May 16th is even lower. And I know they say it's a 2-week lag, but still, that is a big decline, for May 16th. And then they're showing, now this chart is a little confusing when you look at it. It says COVID-19 deaths and deaths from all causes. We had 876,866 deaths. So, some of us may have forgotten about the fact that in our daily lives, we deal with the loss of loved ones on a consistent basis. People pass away from various reasons, not just COVID-19. And this shows this, You had about 800,000 more deaths, a little over 800,000 more deaths from all other causes, and you had 15 deaths from COVID-19 based on this chart. So, I know when you watch a news source, they always highlight the worst part of the situation. Oh, we had, 700 more cases. But 700 more cases doesn't translate to 700 more deaths. So I just want you to put your mind in the right frame of thought, because if you just look at cases and not what actually the outcome of it, the Bible says it's better the ending of a matter than its beginning. All right. Percent of expected deaths, they got 97. They say percent. I'm a little confused about that when they say, is it 97 expense? That's a little confusing when you read that. Because, you look here, or is that the actual number of people, 97 deaths they expect? Because, this number goes up, and here they got these numbers, and then they go really down here. So they stay almost close to 100 or over 100 until you get to May 16th. Really dropping off. Seems like the country is doing a good job with COVID-19, huh? Pneumonia deaths, 83,333. So we got pneumonia deaths. That's the total from pneumonia, not COVID-19. This is the total from COVID-19 right here. So pneumonia has killed more people based on this chart than COVID-19. Okay, that's interesting. Deaths with pneumonia and COVID-19. So they're saying deaths with pneumonia and COVID-19, 27,542. All right, so that's the numbers on that. So do I add this to this? Because they're saying and COVID-19. Influenza deaths, 6,180. That's just people who died from the flu. Deaths with pneumonia, influenza, so it could be one of the three, 123,593. Why is it coded as ors? You will lose your mind trying to figure out how they do this, right? And I don't know if that's on purpose or not. So let's see what these numbers mean. One means deaths with confirmed or presumed COVID-19, coded ICD-10, code U07.1. So That's how that was coded. So if they code it like that, you're gonna get confirmed or presumed. So you got to remember, they're saying confirmed. In my opinion, I'm not a doctor. It would be a confirmed death from COVID-19 was they did an autopsy. Oh yeah, they died from COVID-19. Presumed means we think. They tested positive and we think. So, like they said, the numbers are not going to be accurate. 2% of expected deaths is the number of deaths for all causes for this week in 2020 compared to the average number across the same week in 2017-2019. Previous analysis of 2015-2016 provisional data completeness have found that completeness is lower in the first few weeks following the date, minus 25%, and then increases over time, such that data are generally at least 75% complete within 8 weeks of which the death occurred. So they're saying, so let's go back to that where I was confused. A percent, so that's they expect a 97% increase over those years. Okay, I think I got it. So all of these weeks they were saying 97% over. This is what they kept having these high numbers, but they had zeros. One, look, if it was COVID-19, you're definitely going to have a big jump because we didn't have any COVID-19. But issues back in those days. So here it is, 107. But see, down here, it's promising. Things looks great. Only a 14% they're saying. Okay, let's keep it going. 3, pneumonia death counts exclude pneumonia deaths involving influenza. So pneumonia death counts exclude pneumonia deaths involving influenza. So if it's a 3 code. Influenza death counts include deaths with pneumonia or COVID-19, also listed as cause of death. Okay. Deaths with confirmed or presumed COVID-19 pneumonia or influenza coded to ICD-10 codes U07.1 or J09-J18.9. Okay. If your head's not spinning by now, you're doing good. Because it's a little, I'm really good at deciphering stuff, and I'm still like, why are they very confusing. All right. So let's get to where I really wanted to be. I just went through all of that to kind of give you an idea of how they're coding this stuff and how it can be confusing to understand. And I just want to give a little clarification if I can. Here we go. This is for the United States of America. And so they are saying on this chart, COVID-19 deaths, 62,515. So that lines up with what's up here. Okay. So now we're just going to take these deaths and break them down by states. Now, you can look. Alabama, very low number, 349. Alaska is not reporting anything here. Arizona, low, very low. Arkansas. California, 2004. I know that at one point they was at the height of this whole thing. They got 2004 COVID deaths, and then you got let's just give them COVID-19, 1,174, influenza, and then you had some deaths that could be either one of these. By the way, what's the population of California? Population of California. Let's see if we get a little tally here. Let's see. 39,937,489. They got a hell of a lot of people there, huh? That's a lot. So roughly, I'll take this number just to give it. I'll take this number. Even if, let's just, for the sake of argument, take this number, put them all together, and say that's all COVID. Let's just say that. They're saying over here. I'm just saying that those all. Just for the people that like to err on the side of caution. So what I'm going to do is pull out my calculator and calculate that. Okay, so that's I'm starting from the right side and going back. 8652 plus 1174 plus 2004. So that's 11,830 people. And I just said they had 38 million people. So we just divide that by their population. 937,489 equals 0.00029,621. That's the percentage that they're dealing with on deaths there. Okay. I'm not gonna give you an opinion on that. I'm just gonna showing you what this says. Okay. All right. Let's keep it moving. California, we talked about. Colorado, 921 plus. They got some high numbers over here at the end. Skipping on down. Let's skip on down to New York. They got some pretty big numbers there. 15,757 confirmed COVID. Then they got a mixture of what might be 18,120. I'm not going to do the calculation on that, but let's say, what is the population of New York City? Because let's be specific, because they split that up. City. City means the 5 boroughs. What is, I'm sorry, I didn't even type it. 8.39 million people in the city alone. 8.399 million. That's as of 2018. So we know that's a bigger number. All right. And y'all, you could do the calculation of that based on what I gave you. I don't have time to go through all of that. That's still going to be a very low percentage when you do that. Now, what I really wanted to focus on is this. This right here. This is an article from Dated. Then I just want to show you the date. It's from CBS News. So April 6th, 2020. So this is over a month ago, this article. So this would be a great article to use because just going to show you something. You're going to see some interesting things. These are the states that held out. 43 states now have stay-at-home orders for coronavirus. These are the 7 that don't. This is as of April 6th when this all went down. They didn't have stay-at-home orders. So we're going to go down to it by state. Arkansas. The governor, Asa Hutchinson, a Republican, said that targeted responses to certain communities are better than a statewide order. He questioned the effectiveness of stay-at-home orders in other states, calling them an illusion because residents still leave home for shopping and many even continue to go to work. And I have to agree with him on that. I'm in North Carolina. We've had a stay-at-home order since March, and I went out every day, and people were still doing their normal stuff. Traffic was lighter at first. Now it's like back to normal. And we still have a lot of business shut down. So he's right. To me, it's an illusion. You tell people want to get out and they're going to go out. The only thing different about now basically is people are wearing masks. That's the biggest difference. But as far as people are still in how you interact with the restaurants, takeout orders, blah, blah, blah. The question is, are you accomplishing anything by doing that order? Hutchinson said April 2nd. So this is, he said this on April 2nd. Hutchinson also defended his decision by pointing out that Arkansas has fewer cases than many states that issued such orders. Benton, a suburb of the state's capital and largest city, Little Rock, and surrounding Saline County, issued a stay-at-home order for Midas. Little Rock has night curfew for all residents and youth curfew during the day. Arkansas has reported 854 cases and 16 deaths. So this is from CBS News. So let's go to the CDC report. And that was Arkansas, right? Little old Arkansas. All right, let's make sure. Arkansas, right at the top. So, 472 COVID deaths. Then they got 1789 possibles. Deaths, pneumonia, or so you can say that is or it isn't. Very low confirmed COVID deaths. Then they had pneumonia deaths, 1,438, right on par with this number, 1,789, where they don't have it, they have it all mixed in. And then you had deaths with pneumonia, COVID-19, and 230. Influenza death, 109. I mean, this is clearly low, but they had a total of 19,522 deaths from all causes. Okay. So, very low. I mean, that's the proof is there. This is mainstream media website. They did this report. I didn't. Okay, so let's go back. So they said 854 cases, 16 deaths. So April, they only had 16 deaths on around April 6th when this was published. Iowa, documents released April 1st by the Office of Governor Kim Reynolds, a Republican, showed that the state is using a 12-point scale to decide whether to issue a stay-at-home order. The scale considers factors such as the ages of people with infections, the number of hospitalizations, and the rate of long-term care outbreaks. According to the documents, the governor would issue a statewide order if 10 points are scored on the scale, which has yet to happen. In the meantime, the governor has temporarily closed many businesses and banned gatherings of more than 10 people. Healthcare professionals in Iowa have been calling for her to issue a statewide order. So the healthcare people said issue a statewide order. Iowa has reported 946 cases and 25 deaths. So Kim Reynolds, governor, made that decision. Let's see what the report says for Iowa. Iowa, 200. Very low, see? Low across, really low across the board. 200 deaths. And then you had a mixture over here, 863. Now, mind you, New York's had like one of the first they had the lockdown orders and they had the highest. Of course, they do have more people. You got to put that in there. But all of the states seem to me that had these lockdown orders seem to have higher numbers. Georgia had a lockdown order, and here it is up here, 956 COVID deaths. And I got people publishing on my page, 500 more cases in Georgia since they opened up. They keep putting those numbers out there. But this chart is proving that just because you get more cases, you're not going to get more deaths. It really is. It's revealing that. So, it might be a good idea to put away the fear. Nebraska, Governor Pete Ricketts, a Republican, said the right approach for the state is responding county by county. I agree. When there are signs of community spread, he noted, though, the other governors have been urging him to issue a statewide order. So far, 56 of the state's 93 counties cover more than 80% of its population have enacted health measures in response to coronavirus. Nebraska reported 409 cases, 8 deaths. So let's go to Nebraska. 43 deaths. So now we're May 18th. So they only have 43 deaths since that time, this article. So they never really received a real crisis as other states. That's really good numbers, for these states that are choosing to think about their economy as well as the health and safety of people. They did it, it's very low. Look, 43, that's confirmed COVID. The other ones are possibles. Still, all of these are possibles because they say, presumed. Presumed. Y'all know what presumed mean, right? Okay. North Dakota. Governor Doug Burgum, a Republican, has not issued statewide orders to stay at home, though he did temporarily close bars, restaurants, theaters, schools, and other venues. And so he closed some bars, restaurant, theaters. I mean, I can agree with that. It's not about staying home, it's about avoiding contact, the governor said March 25th. While adding that he was open to different guidance if the situation changes, he said North Dakota was blessed compared to other states because of its relatively low number of cases. So let's go to, they got 225 cases, 3 deaths. So let's go to North Dakota. 17. So they had 14 more deaths since that time. Confirmed deaths. Let's keep going. South Dakota. Governor Kristi Noem, a Republican, says statewide orders will limit the rights of individuals in her state. I love that. I love that she's thinking that way. South Dakota is not New York City, she said. That's true. In a press conference April 1st, later urging residents not to turn on the news and look at New York City and think that that's what lemon South Dakota is going to face in a month. Right. Good. Man, that's a very good suggestion. If you watch the news and you're looking at all these other places, it will scare the hell out of you. She also suggested that following social distancing orders should be voluntary. The people themselves are primarily responsible for their safety, she said. They are the ones that are entrusted with expansive freedoms. They are free to exercise their rights to work, to worship and play, or to even stay at home or to conduct social distancing. I also noticed that these are few women governors who's making these decisions. And I gotta say, they're making some very good decisions. You know, maybe we should get some more women governors. Maybe that should be the case because some of these guys are making some crazy decisions. And, you know, because when I show you what the numbers are in North Carolina, you know, which is right on par with a lot of these. Norm stood by her stance even after acknowledging that up to 70% of the state's population could contract the virus and that a stay-at-home order could slow the spread. South Dakota's reported 288 cases, 4 deaths. Okay, so let's go to South Dakota. 21, 8 deaths. They only went to 21 in over a month. So she made a good decision. Come on, you got to give credit where credit's due. All right, Utah. I'm not going to read all that. It says 1,605 cases and 8 deaths. Let's go. Utah, 58. So they have 50 more deaths since the time of that article. 399 ifs, ands, and buts. Let's go to the last one. I think it's the last one. Wyoming, 210 cases, no deaths. This was March 30th, he said this. This article, April the 6th, I believe I said. So let's go to Wyoming. Drum roll. What? Absolutely nothing. Absolutely. They got zero. They got 113 if, ands, and maybes over here. And they had 1,336 from all. They expected a 94% jump. Didn't happen yet. And 102 pneumonia deaths. So pneumonia was more dangerous than COVID in their state. Deaths with pneumonia COVID-19, absolutely nil. Influenza death, absolutely nil. Then they had 113 if, ands, and maybes. Right there. Now, I'm in North Carolina. And we've been shut down since March. 149 confirmed. 1,361 if, ands, and maybes. Which is higher than a lot of the states that didn't shut down. I mean, so the shelter in place, stay at home stuff, did it help? I don't, based on the chart, I don't see a difference. South Carolina shut down too. My daughter goes to school there. It's 267, and they're on par with everybody else. So it's not really states that didn't shut down, states that did. They were saying if you didn't shut down, if you did all of this, it would increase. None of that had translated to anything. So that's, in the beginning, I think there was a lot of panic and people had these broad and bodacious numbers, and everybody was scared and frightened. And it's proving that, look, it seems like COVID-19 is getting tired. Because look, May 9th to 20, that's a huge jump. That dropped down. See, like if you look here, 321, 510 didn't jump up to 2,000 something. It's almost like it just as fast as it jumped down and just as fast as it's going to go down. Oh, well, could it be something else? Who knows? Like I said, I'm not going to share my opinion. There's a lot of thoughts out there. People think what they're thinking. That's not the point of this. I just want to just show you the numbers. All right. Remember, today's Tuesday, right? 7 p.m. Eastern Time. Blog Talk Radio / Hindsight 2020. Akemail.com. If you want to call and ask questions, you can call in. And the call-in number is, give me a second to pull it up on my phone. It is 563-999-3615. Speak to me live on the air, 7 p.m. Eastern, every Tuesday. All right? Peace, and have a good and prosperous day.